Welcome to the Plain English Public Health Weekly Report. I'm Richard Greenland, and today is March 19th, 2021. As always, we start with our COVID-19 statistics. Worldwide, we have nearly 123 million cases and over 2.7 million deaths. In the United States, we have over 30 million cases and over 553,000 deaths. Let's start today's report talking about kids and COVID-19. Children haven't been affected as much as adults with COVID-19. The number of cases and especially the number of hospitalizations and deaths have been much lower for children. It just doesn't seem to be an issue with children. Of course, that doesn't mean it's not an issue at all. There have been some deaths and hospitalizations, and some kids have had serious conditions. But generally speaking, it really has not been a major issue with children. Because of this, and because of a new study that's come out of Massachusetts, the CDC has changed one major bit of advice that they're giving for opening schools. Previous to today, today was when they actually changed those guidelines, but previous to today, the advice was to have desks at least 6 feet apart, similar to social distancing guidelines where you want to be at least 6 feet away from the person next to you. Now they're changing it to be 3 feet apart. The previous 6 feet apart guidelines were very prohibitive. For many school districts, that just wasn't a possibility. They just didn't have the space in the classrooms to allow for 6 feet between desks, unless they were going to do, partial remote learning, partial in school, or maybe, half the students one day, half the students the next day, etc. This 3 foot option does help to make it more possible for the majority of school districts across the United States to actually have all the children in school at the same time. Now, this guideline does come with one caveat. That is, you must wear masks. If you wear masks, then the 3 feet distance is fine. You should be wearing masks anyways, whether it's 3 feet or 6 feet, but the 3 feet is it's an absolute must to wear that mask. So, if kids would just wear masks and if all the teachers would wear masks, school would pretty much go back to just about normal, except for those masks pretty much, for the majority of children in the United States. So please go ahead and wear those masks when going to school, and schools, please start opening up following these new guidelines. Remote learning is good for a lot of children, but for a lot of children, they just learn a lot better when they're in person, around other kids their own age, being able to see the teacher, being able to work with their hands more, things like that. As far as remote learning goes, it should continue to be part of school, at least in my opinion. My dream for this would be that the remote learning and the in-school learning would continue regardless of whether we're going through a pandemic or not, because there are lots of kids that for whatever reason are not able to be in school every single day of the year. Whether that's because of a chronic illness or just missing a few days here and there because of sickness or something else. Having that remote learning option available would make it so that they could still continue to go to class even if they're not able to physically go to class. Now, I realize that this may not be an option everywhere. There are tons of possible issues with this, money-wise, effort put in by school teachers and administrators to get this all working, just a number of different things. Some of this is technology, for example. Internet access is problematic for a lot of children, especially those in poor households. So there are a number of things we would have to get over, but those obstacles can be overcome if we work together. So I would hope that everyone in the world leaders, and just regular you and me, would try to prioritize our children's education. This may sound cliche, but they are the future. They have to be the future because they're up and coming. And so we need to prioritize giving them an education. And if that means making it easier for them to receive teaching both in school and remotely, we need to lay the framework for that. We need to have the internet access available. We need to be trying to get rid of the poverty that causes so much so many problems with education. Certain groups are at a disadvantage because of poverty or other things. So we need to be working on that as a worldwide community. So moving on, a little bit more about children. Children have not been focused on or prioritized for receiving the vaccine, mainly because they just haven't had as big of an issue with COVID-19. So now that we have quite a bit more of the vaccine available, and many adults are able to get it, in fact, the Biden administration is hoping to have it available for all adults to get by May 1st at the latest in the United States, and worldwide other countries are trying to get it also as soon as possible. But since we have so much available now for adults, some of the focus is now turning towards children. Moderna, the vaccine company, has already started a trial for adolescents, those children ages 12 and above. And so far, the results are looking good. They're looking similar to the results from adults, which was expected, but it's good to have the actual evidence from those trials. And so now they're actually starting trials with younger children, those under 12. They'll actually have slightly separate protocols for those that are under 1 year old versus those that are over 1 year old up to 11 years old. So they're going to be getting those done. The timeline here that we're looking at is they're hoping to have and actually expecting to have a vaccine ready to go for adolescents before school starts up again in the fall. That's their goal. As far as the younger children, it may be a little bit longer because they started those later. So most likely that'll be towards the end of this year or possibly beginning of next year that we'll have vaccines for them. Thankfully, they're not as high risk, and so it should be okay. As we say that, of course, we want to make sure that everyone has the best outcomes available. And there's always these variants that could possibly turn to go towards the children if the adults aren't available. So it's important that we get these out as quickly as possible. But thankfully, the more people that get vaccinated, the less likely it is those variants will be able to change. They won't be able to mutate if they just don't have the hosts to grow in. And so everything should work out fine if we can just get people to be vaccinated. So we do have a bit more news this week about vaccines. Not dealing specifically with children, but just generally vaccines. First off, many European nations stopped using the AstraZeneca vaccine a couple weeks ago. And the reasoning for that was because of reports of possible blood clots in the brain being caused by the vaccine. Now, the number of blood clots is tiny compared to the number of vaccines given, and there is no actual evidence yet that the blood clots were caused by the vaccine. There is one study that came out that has not been peer-reviewed yet that claims to find a possible way that the vaccine may be causing the blood clots. But like I said, it hasn't been peer-reviewed yet. We're not completely certain that that's true. And the thing is, even if it were true, the tiny percentage of people getting the vaccine that are having the blood clots, it's smaller than the general population. A smaller percentage of people than what normally would just on any given year. Also, birth control pills cause the same kind of blood clots in higher amounts or higher percentages, and they're considered safe. So if you're okay with taking birth control pills, then you should be okay with the vaccine. Don't stop getting the vaccine just because you're worried about blood clots. Also, these blood clots, as long as they're caught early, you can recover from them just fine. No major issue. And that's one reason why birth control pills are considered safe, because they're able to be caught fine as long as you're paying attention. So same thing with the vaccine here. Again, we do not think that it's causing it. Even if it is, it's still more important to get the vaccine because of this tiny, tiny chance of having these blood clots. It's so rare. The European Medicines Agency, one of the regulatory bodies there in Europe, they actually came out and said, look, we've looked it over. seems safe to us, you should continue using it. The World Health Organization has also basically said the same thing. So now, this week, some countries have decided to start again. Either one of them, I believe Germany was one starting today, to give the AstraZeneca vaccine again, and some other countries throughout Europe are going to be starting over the weekend or into next week. There are still a couple of holdouts. Norway and Sweden have decided that they're still not going to start up with the vaccines yet. They want to do a little more research on it. We've talked about some of the bad choices Sweden has made dealing with the pandemic so far. This, I consider it to be another one of their bad choices. They don't have a stellar track record facing this pandemic. Then again, the United States really doesn't either. We're getting better, but we haven't had a great track record on the pandemic either, so we're not really a nation to talk. So, also in vaccine news, we mentioned this before, but those who have long-haul COVID, the symptoms that last a really long time even after they're quote-unquote recovered, many more people are coming forward and saying that the vaccine actually cured their symptoms. We don't have a study yet. We don't have any actual scientific evidence that this is happening, and scientists don't understand the exact mechanism for how it could cause this to happen, though they have some theories. But just the sheer number of anecdotal evidence, all the stories that we're hearing, is encouraging. It seems like this is probably the case where you've got a good chance of recovering from long COVID once you get the vaccine. So hopefully that is. Like we said last time, we're going to have to wait and see to get some studies done and everything to see if this really does work, but hopefully it does. To those who are avoiding getting the vaccine based on your political views, please be aware that both President Biden and former President Trump have gotten the vaccine, and they have both come out in favor of the vaccine and said, please get the vaccine. President Trump had not actually done that for since he'd gotten it, but Dr. Fauci kind of called him out on it earlier this week on one of the TV shows he was on, and said, it would be really good if former President Trump would come out and say that. A couple days later, President Trump went ahead and did so. So please, regardless of what your political views are or any other reasons you may have, please get the vaccine as soon as it's available to you. The more people who get the vaccine, the faster we can hit that herd immunity, and the faster we can protect the vulnerable people who are not able to get the vaccine for whatever reason. So please, get that vaccine as soon as you can. Another thing about vaccines, I first heard last week about accusations against the Biden administration that they were stockpiling vaccines instead of giving them to either the American people or sending them to other countries. As a public health professional, I'm very much against withholding care from people. I understand that we need to have, supplies available for a time of need. COVID-19 is one of those things where you can't wait. You have to get the supplies out. Those vaccinations have to get out as quickly as possible so we can stop things. So I had not heard of this before, and so I decided to do some research. It didn't sound like what I'd heard was happening, and so I thought maybe there was some other or a bit more to the story. So I went ahead and did some research, and it turns out that the United States does have a stockpile of vaccines, but it's the AstraZeneca vaccine, the one that has not yet been approved for use within the United States. And so AstraZeneca has created them, they've sold them to the United States, but the United States just cannot use them yet because it hasn't been approved. I really hope that they approve it soon. Other countries have approved it. We haven't seen any major issues. We talked about the blood clot issue earlier, but still, it should be getting used. And so it's not a good thing that the stockpile is there, but it's understandable considering the current situation. Basically, AstraZeneca has to get all their ducks in a row in order to submit it all to the FDA so the FDA can go ahead and sign off on it. It's a process, but hopefully they can speed this up a bit. That being said, this week, the Biden administration did announce a tentative agreement. It hasn't been completely done yet, but it's a tentative agreement to actually send nearly 4 million of those vaccine doses of the AstraZeneca vaccine that they've got stockpiled to Canada and Mexico. So that is definitely a good thing. We need to be sharing with the international community. So as far as sharing with the international community, you'll hear some people say, oh, we should take care of ourselves first and then send it out. And we do need to have enough for ourselves. That is true. But we also need to help others. Because if you look at the variants, the majority of the variants that we're seeing in the United States right now are ones that started in other countries, got a foothold there, spread a lot, and then spread to the United States. Despite the all the different things that we have in place to stop the virus from spreading, it's not working. The virus still spreads across country borders. Checking temperatures at airports doesn't seem to work. We just need to be more careful with the basic guidelines, and even then, it's not 100%. And so, the only thing that would really work the best for this would be to make sure that the sources of the virus, whatever country it's coming from, make sure they are vaccinated. If we get people vaccinated, then the variants won't have hosts in order to multiply and spread further. So we need to get those vaccinations out. We need to make sure that other countries have them just as much as we do. There is no point in us pretending that we exist on our own little world, by ourselves, and nothing else can influence us. That's just not going to happen. We're international. Today is so connected. The world is so connected today. So we need to realize that we're part of an international community, and what happens in other countries affects what happens in the United States. As much as we try to avoid politics here on Plain English Public Health, I do want to say that while patriotism is really good, nationalism is terrible. There's a big difference between those two terms, patriotism and nationalism. If you don't know the difference, please look it up. But basically, nationalism is a disease. It's a disease that causes us to become weak, just like any disease does, even though at the time we are participating in nationalism, we believe that it's going to make us strong. It will not. Nationalism just eats away at the very core of what the United States is. The United States of America was built on a constitution and just principles in general that do not support nationalism. Not at all. They support patriotism, but not nationalism. So I'll step off my soapbox now. But thank you for listening to that, and please figure out what that nationalism is versus patriotism if you don't know already. Thank you for watching the Plain English Public Health Weekly Report for March 19th, 2021. As always, we have links below the video to give you more information on the stuff we talked about, and also to introduce you to some topics that we weren't able to get to today. I'm Richard Greenland, and you have a healthy weekend.